Hello everyone, I am finally making another video. It's well overdue, but I have said in my previous videos that I was going to be waiting to get my reversal done and reverse the bag, and I would be also having my colon removed. Well, they found out that they wouldn't have to remove any of my rectum, so that didn't put me in any danger of not being able to have children. So I decided to go ahead and do it sooner. This year, my deductible's already met, so I wouldn't have to pay any more as far as my insurance goes. And here in the United States, most of us know that insurance is very expensive. So I went, and as you can see, I'm in the hospital right now. I had, today is the, 6th? Yep. Yesterday, November 5th, 2021, I had my reversal surgery as well as the total colectomy and the ilieorectal anastomoses. So I just kind of wanted to make a video on that and touch briefly on what it was like to have the ileostomy for 7 months. It absolutely gave me my life back. If you're considering it or worried, or you're already going to get it but you're not sure what it's going to be like, it's definitely a learning curve. You will get adjusted to it. It's hard to imagine that having something like that done would become your new normal, but it absolutely will. It's not difficult. You have to, of course, figure out which products work best for you. I personally used Convatec, and I enjoyed them. I've tried Coloplast and Hollister as well. I just liked Convatec better for me personally. My skin didn't react to it poorly, and everything worked like it should. And believe it or not, I never had an accident out in public where I had a leak. I've had leaks before, but it was usually because of what I ate or something like that, where it got a little bit underneath the wafer. But I've never had a leak where I got it on my clothing or in my bed or anything like that. So I was very fortunate in that aspect. But let's see. So as far as the reversal goes, it was a success. The surgery was a success. I am going to be in the hospital until my bowel wakes up, and if you've seen my previous videos, you know that it took 5 days last time for them to wake up, 8 days before I could go home out of the hospital. And so I know that it might take time. It has just now been over 24 hours. So, you know, it's gonna happen when it happens. It doesn't at its own good time. Walking and trying to eat light meals frequently and chewing gum helps to wake the bowel up. So I've been doing all of those things, again, just like I did with the ileostomy. I've got 5 scars, or well, I should say 5 wounds on my belly. One of them was the same one. One of them was one of 2 that they used whenever they did the laparoscopic ileostomy. So I call them port wounds. They're just 2 little dots. They were able to reuse one of them, and then I got a couple of new ones. But they're small. They're all covered by Band-Aids, minus the area where my ostomy used to be. It's got a wound vac on it, so it's, you know, keeping the wound more closed. It keeps blood flow to the area so it heals quicker, and any of the nastiness that might be, you know, coming off of it or out of it or oozing like wounds do, you know, just a little bit of excess blood, a little bit of extra skin tissues and such like that. It's taken all that away. I might be able to get that off tomorrow, they said. It doesn't really bother me. I'm in a fair amount of pain, as you can imagine. The pain medications that they're giving me are working, so it's not unmanageable. But I know that I can't keep taking them forever, because that also makes your bowels slow down, so I'm not looking forward to going no pain meds. But Tylenol will just have to do. That's what I did during the ileostomy surgery, so it is possible. I had a catheter in, a Foley catheter. They took that out this morning, and now I'm taking myself to the restroom with a little bit of assistance, because you got to drag around the wound vac apparatus and the IV pole as well. So I do get a little help with that. My husband's here, and I'm thankful for that. But yeah, that's pretty much it right now. They moved me to a low-fiber diet this morning. Yesterday I was still on the clear liquid diet, and I'm not eating anything heavy or a lot of it at a time. As I said, it's better to eat small portions but more frequently throughout the day, and because my bowel has just gone through a very harsh thing. It's in shock. We don't want to make it worse by putting too much food into it and trying to get it to do its job after it just had some serious trauma to it. So, let's see. They don't know when I'll go home because it all depends on when my bowel wakes up. You've got to eat and keep it down, and you've got to be able to pass gas and pass stool. So those are the things I need to have happen before they will release me from the hospital. I am able to move. It is painful, but if I take my time and go at my own pace, it's completely achievable. I would encourage anybody that wants a reversal to, ask lots of questions to your doctor and your surgeon, and they should be able to give you the best advice possible. This was the right move for me personally, just because of the issues that I had, that I had to have the ileostomy first. That was always going to be step 1 of 2. It was never just going to end at the ileostomy unless something went wrong and I wasn't able to have the reversal, but thankfully I was. So I have now had the reversal, and I'm currently in full swing recovery mode. I have been drinking lots of water. I had, what did I have for breakfast? Frosted Flakes for breakfast, and nothing anything like that. I did eat some noodles with a little bit of Alfredo sauce a few minutes ago for lunch, and it's just kind of hard to eat multiple small meals a day in the hospital whenever they operate on a breakfast, lunch, dinner kind of schedule. And I look a little gross, but I'm in the hospital. What do you expect? But everything went well. I'm trying to think. My wounds were stapled, the small ones. Like I said, though, they're completely covered up by Band-Aids, so they're not that big, minus the ostomy site. And walking. That's really all I'm doing. I know I'm sleeping on and off, of course, but that was just a major surgery, so that's not surprising that I need a little extra sleep. But I'm trying to think of anything else that I could say that you might have questions about if you read this or watch this video. But I will keep an eye on the comments. If you have any questions, I'd be happy to address them. I'm still really tired, so my brain is probably not at optimum functioning capacity at the moment. But I know it's all scary. I know getting an ileostomy is scary. I'm sure colostomies are the same, although that wasn't my personal experience. And but if there's a reason you need these, they change your life, and for the better. Yes, it's a learning curve. Yes, it's frustrating. And yes, you go through pain during the recovery process, but you could have a tooth pulled at the dentist and go through pain for a little bit too. So it's just the same concept, common sense. And I would just say that once you get into the swing of things, it's just like you get up, you brush your teeth, you brush your hair, you wash your face in the mornings. It's just another step in your daily routine. Emptying the bag, doing bag changes as often as you need to. I personally chose to use a 2-piece system, and I changed my bag depending on what I'd eaten and how it was going every 4 to 5 days. And that's with an ileostomy. A colostomy is a little different as far as I understand, but and then just emptying the bag throughout the day as needed. I'm happy I don't have to wear the bag anymore. Not that I hated it, but of course I think I'd prefer to live without it if at all possible. So it was not the worst thing. I was able to still live. I was living a much more full life than I was before the surgery for the ileostomy placement. And I'm just happy to be here now and healing, and I guess I'll kind of just be out of work for the holidays by default. And that's kind of nice in a way. It's just kind of nice to can sit around the house and decorate for Christmas and Thanksgiving and enjoy that. I probably will be going back to work, but working from home before the end of the year. But yeah, I will be doing pelvic floor physical therapy as well in 6 weeks from yesterday. It's just to strengthen back up the muscles, because when you have an ileostomy for any length of time, my case was 7 months, obviously I'm not using those muscles in my pelvic floor. And whenever it does wake up, it's like very highly likely that I will have where I cannot control my bowels at first. You could say fecal incontinence. It is a situation where when you get the urge to go, you can't hold it and run to the bathroom. It just kind of happens. But once my body gets back used to using all of those muscles again, coupled with the pelvic floor physical therapy, it will be back to normal. As long as I keep track of what I eat. Obviously, if I just drink a bunch of liquids and I'm not eating, solid, good bulk food, then it's of course going to be looser than it needs to be. But I've learned how to manage that with my ileostomy, so I'm optimistic about doing it now. Applesauce is your friend. If you are having trouble with loose stool or output, however you prefer to call it, whether that's with the ileostomy or the reversal, if I would eat 1 or 2 cups of applesauce like you would put in a child's lunchbox, it pretty much had me straight for the rest of the day. I didn't have to worry about getting dehydrated or running to the bathroom every hour to empty my bag, which is a good way to get dehydrated. Loosening things up, soda, tea. If you like beer will do it. But I recommend doing all of those things in moderation, because once you speed it up, it takes a little bit longer to slow it down usually. I'll be, of course, watching what I'm eating in my portions right now, because my bowel is swollen again like it was during the previous surgery. So there's a higher chance of getting a bowel obstruction. And if you recall, I had one of those after my ileostomy surgery. So I will definitely be doing anything I can to avoid that. And yeah, I think that's about it. I would definitely recommend it if it's something available to you. And, unless you're just in love with having your bag, I would definitely say try a reversal. As with any recovery process, it kind of sucks, but this too shall pass, right? So it won't be this way for forever. And I'm trying to think anything else. I'm not having any new medications once I go home, anything like that. I shouldn't need even home help this time like I did when I had the ileostomy removal. I'll go home, relax, and try to take it easy and heal and walk as much as I can at my own pace, and building up to walking further as I go, as the days go by. Walking is something that will help you get your energy back more quickly, because as always with any major surgery, you lose a lot of your strength, because as you can see, I'm sitting in a hospital bed. So I am getting up and walking around, but it's not the same as being as active as I was before the surgery. So I would definitely want to get my, strength back. And that's one great way to do it. Making sure you're eating high protein foods will definitely help as well, because your body is depleted of its energy. So we want to give it back so it can function as it should again as quickly as possible. But if you have any questions, feel free to reach out in the comments section. I'd be happy to talk to anybody. If I have the answers, I'd be happy to tell them. If I don't have the answers, I probably know a resource for it. So yeah, I just wanted to give y'all an update. I'm sorry it's so overdue and I didn't give any more ileostomy updates in the meantime, but life was crazy this year. I think it has been for everyone, between work and the Delta variant being back out and, just everything else that's going on. And it just kind of fell on the wayside for me to make videos, although I wanted to and I should have. But yeah, if you have any questions and I'm able to help, I'd be happy to. Leave a message in the comments. I do read those. Sometimes I'm a little late on reading them, but I will make a greater effort to check those comments more frequently after I post this video. If it is enough of the same question, or if it's something I think worth elaborating on, I'll make another video in response. But I hope y'all have a great day and make good choices and stay healthy and safe and live your best life. Thanks.